Hi, my name is Blair Segura, and I'm a student at the University of Louisiana at Lafayette, and I'm currently enrolled in the Health 412 class, which is Health and Sexuality. This is my public service announcement on MCV, which is Molluscum contagiosum virus. Molluscum contagiosum is a viral skin infection that causes either single or multiple raised pearl-like bumps called papules on the skin. MCV is caused by a virus of the same name that is part of the pox virus family. The virus is contagious through direct contact and is more common in children. However, the virus can also be spread by sexual contact and can occur in people with compromised immune systems. MCV is spread from person to person by touching the affected skin. It can also be spread by touching a surface with the virus on it. This could be linens, toys, or clothing. A person can spread the rash to other parts of their body by scratching the infected area and then touching another area on their body that is not infected. Washing your hands thoroughly is the best way to avoid catching MCV. Do not touch, pick, or scratch you or anyone else's skin that has bumps or blisters. Abstinence is the number one way to prevent the spread of STDs and STIs. There are a number of treatment options, but it is best to talk to your healthcare provider to see what is right for you. MCV is usually self-limited, so treatment is not always necessary. In the majority of cases, the virus heals completely without treatment within 6 to 12 months, but it could last longer. They have other options such as serotherapy, which is freezing the growth, removal of fluid inside the lesion by cartridge. They could laser the bumps off the affected area. Certain creams can be prescribed but cannot be effective, but may not be effective. And oral medication is also an option. Papules on the face, trunk, and limbs of children, and on the genitals, abdomen, and inner thighs of adults. The condition usually results in papules that are generally painless but can itch, are small, 2 to 5 millimeters in diameter, have a dimple in the center, are initially firm, dome shaped, and flesh colored, become softer with time, and have a central core of white, waxy material. The U.S. National Library of Medicine National Institute of Health reported from 1990 to 1999 in physician office visits by patients with MCV and patient demographic parameters including age, gender, and race. We found that healthcare utilization for MCV was the greatest for patients 9 years of age or older, which was 51%. 93% of patients diagnosed with MCV were white. The number of visits for MCV was evenly divided between males and females. Visits to dermatologists comprised the majority of the healthcare utilization units for MCV, which was 71%. The U.S. National Library of Medicine National Institute of Health analyzed data on MCV infections in the United States from two sources: the National Disease and Therapeutic Index Survey of Private Patients. The data was collected during 1966 to 1983, and two sexually transmitted disease clinics information was collected during 1977 to 1981. Patient visits to private physicians for MCV increased 11-fold from 1966 to 1983. Over the same time span, the proportion of private patient visits also increased from 1.2 to 11.0 per 100,000 total clinic visits. Clinic patients, however, showed stable trends in proportions of individuals infected over the time period of 1977 to 1981. Clinic patients 15 to 24 years old and private patients aged 20 to 29 years were more likely to present with MCV than patients in other age categories. Like the prevalence of other viral sexually transmitted diseases in the private medical community, that of MCV infections appeared to have increased dramatically over the 18-year span covered by this study. MCV mainly affects children, but in adults, the advent of HIV has modified its clinical spectrum. Our study is designed to ascertain the clinical profile of MCV in children and adults and to discover the effects of underlying HIV infection. During the study period of September 2000 to June 2002, 150 cases of MCV were screened and recruited at the Department of Dermatology and STD. These include 137 children, 85 males, 52 females, and 13 adults, 10 male and 3 females. In children, MCV is most commonly seen in the ages of 5 to 10 years old, which was 58 cases, followed by 1 to 5 year age group, which was 53 cases, the 10 to 14 year age group, which was 23 cases, and the younger than 1 year age group, 3 cases. In adults, MCV is most commonly seen in the 14 to 20 year age group, followed by 2 cases, each in the age groups 20 to 26 years, 26 to 34 years, and 34 to 40 years. The male to female sex ratio was 1.6 to 1 in children and 3.3 to 1 in adults. In both children and adults, the most common sites affected are the head and neck, followed by trunk, upper extremity, genitalia, and lower extremity. It appears that the distribution of molluscum in our patients is significantly affected by the high proportion of HIV-positive adults in our sample. MCV is more commonly seen in children under the age of 15 years, about 80% of the reported cases. Children aged between 1 and 4 years are affected the most. When it appears in teenagers or adults, it is frequently transmitted sexually and therefore may be considered an STD. This viral disease is contagious until the bumps are gone. MCV does not infect animals, only humans. Diagnosis is usually made if a doctor detects the pearly or flesh-colored bumps on the skin. The virus cannot routinely be cultured. Any part of the body can be affected except for the palms of the hands and the soles of the feet. Diagnosis by visible signs and symptoms is usually straightforward. If the doctor is not sure or if one spot that looks different from the rest, he or she may take a skin scraping from the infected area and examine them under a microscope. This is called an excisional biopsy. The doctor may take a sample of fluid from the center of the papule and have it tested for MCV. This would be considered a fluid sample. If the patient has MCV in their genitalia, the doctor may refer them to a genitourinary medicine clinic to be tested for other STDs. If the patient's eyelid or eye is red, if they are HIV positive, and if their mucosals are severe or if their immune system is faulty, the doctor may refer them to a specialist.